Welcome, everyone. Einstein's Eyes. I'm Carl Rosen, a fellowship-trained oculoplastic surgeon in Anchorage, Alaska. This is my colleague and friend, Jon Ditkoff. Jon?
Hi, guys. How are you? So I'm in New Jersey. I'm a cornea specialist. I'm happy always to see Carl as we make these videos.
Yep. Jon and I were co-residents at Albert Einstein back in the 90s with Ron Bird as our chairman. We miss Ron. But we're going to talk about today, what we're going to talk about is keratoconus. And Jon is a cornea specialist, fellowship trained. So that is his specialty. And that's amongst other things. But Jon takes care of keratoconus. So I'm going to let Jon take this away, this topic. And I think we'll all learn something. So I'm excited.
So, hey, yes, we're going to try to make this brief, and we're going to go over an overview of keratoconus, diagnosis, and treatment. So as we can see here, is the normal anatomy of the eye is on the left. And you can see the front part of the eye is called the cornea. And then the inside is the lens. And then the light goes all the way to the back of the eye. But that's the front of the eye that focuses. When you have an abnormal cornea, keratoconus, you can see it's shaped like a cone. That's the cornea being shaped like that. And the name comes from keratoconus, which is kerato means cornea, and conus is cone. So it's a cone-shaped eye. So that's the disease of keratoconus. It just means that the cornea, instead of being round like the left picture, is more like the. So it's the same thing here. You have the left eye, and then you look at the right eye, you can see that it almost looks like a cone at the top tip of the cornea. So the problem with this person early on is that the cornea, because it's shaped like a cone, doesn't focus normally. So these patients will come in saying they're out of focus, and normally you would give someone a pair of glasses. Glasses might not work, or if they do work, there's a lot of astigmatism because the eye is not round, and it's called irregular astigmatism because it's extremely irregular. So it's not a round eye, and that messes with the focusing properties of the person. Now, early on with someone with keratoconus, it's very important to do a special test, which we're going to look at next. That's called a topography map. This is like a map showing thickness or actually height. So if you look at the left one again, that's a normal astigmatism. So if you look at that red area going through the middle, that's astigmatism going from top to bottom. So that this person's eye is shaped kind of like a football, but they have normal vision. They can see normally with glasses. They have no disease in their eye, just the way it's shaped. On the right, you can see that it's an irregular cornea. So that means that the astigmatism is not regularly, it's very irregular, and it's just in the inferior part where that red area is. And that makes the vision very difficult to focus. So when someone has keratoconus, this is the map that we'll use to diagnose this in our office. And once we see this, the sooner we take care of this person, the better. So in the old days, when Carl and I were training at Einstein, there was really no treatment for this. We just monitored someone. And eventually, if they couldn't see well with glasses, we'd fit them with special contact lenses. And the contact lenses were hard lenses. So they would actually flatten out that shaped cornea so the person could see well. And that's the old days. Nowadays, there's actually a treatment that's somewhat preventative. So it's actually pretty amazing. So if you catch someone very early with keratoconus, if you see this map, you can do a procedure that stops them from progressing right at that moment.
Right. And Jon, just if you let me just highlight my simplistic view of the topography. This red is steep. This is sort of this is the cone. So if this was a mountain, this would be the top of the mountain, and this area would be the base.
Correct.
So this is normal astigmatism, and this is the cone right here. Whenever you see this, you know you have keratoconus, right?
Correct. So there could be different degrees of it. Keratoconus most commonly presents people that are young. Is young. I've seen it in 14-year-olds, 13-year-olds, but the most common age is probably someone in their 20s. So it's very important for the doctors to pick up on this. If someone comes in with a significant change in vision, especially if they're not able to be corrected to 20/20 vision, or they have new astigmatism in someone in their 20s, that's really unusual. So they should do this map. And once you do the map, you can pick up on keratoconus. And once you pick up on it, then you can recommend a treatment. In the old days, as I was saying, there was really nothing we could do. But now, if we caught this early, we would do a procedure called ultraviolet cross-linking. And by doing this procedure early on, you can stop the progression of this condition. If you don't do the procedure and it progresses, the person not only won't be able to see well with glasses or contacts, but they won't even be able to see well enough that they would need a corneal transplant. And that's what we're trying to prevent and stop the need for. So there's a spectrum in this condition. The earlier you catch it, the better the prognosis. I have many people that I've caught early that are doing fine just with wearing glasses. Some of them will be caught it early, but not early enough. They need a contact lens to see well. So there are special contact lenses, not regular contacts, like for cosmetic reasons, but they're either called scleral lenses or rigid gas permeable lenses. And those are special lenses we do to basically flatten the cone so that person can actually see normally. And then if they can't see well with either the glasses, contact lenses, then they need a corneal transplant. So ultraviolet cross-linking is a miraculous treatment. It's been around for 10 to 15 years now, but in the old days, it wasn't around. It's actually relatively simple. It's relatively safe. It's covered by insurance. And it's a procedure that strengthens the cornea. And by strengthening the cornea, you prevent the progression of the disease.
That's great. So John, so thank you. So that's a really interesting topic. And we actually have some methods that can help folks. So
yeah,
this is very interesting for those who are afflicted by this keratoconus. So I'm glad that we discussed this topic and we made a video about it. I'm going to publish this soon. Thank you, everyone. John, great seeing you. And come and see us next week for another interesting ophthalmologic topic discussion. See you guys.
Great to see you.